Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Hello. You are welcome to the next episode in our podcast series, Healthy Living Podcast Series. Today, we have a special guest in the person of Mrs. Biola Adewusi. She's well known in the fertility space in Nigeria. And in fact, she's the current second vice president for the Association for Fertility and Reproductive Health, a conglomerate of fertility professionals in Nigeria. She's also the chairlady of the Fertility Support Group Association. This afternoon, we are going to talk about surrogacy. And I am sure that majority of us will all know that recently there has been a lot of controversy, both positive and negative, around surrogacy in Nigeria. We're going to look at the reason why these controversies are spearing up now and what the Association of Fertility and Reproductive Health in general intends to do about it. And we also know that in the National Assembly, there are two bills on surrogacy that are on the ground and slated for discussions. And the progress of this will also be discussed today. Thank you, Mrs. Adewusi, for accepting to be here today in our next episode.
Thank you, Dr. Akinola, for having me. It's actually a pleasure to be here. I'm very happy to come and discuss this topical topic with you today.
Can you give us a little bit about your background, please?
Oh, my background. Well, I have an interesting background. I did many things. I started off in accounting and then I veered into human resources. And then, of course, came back to the science space and became a medical sonographer. So professionally, I do ultrasounds. I do female pelvic ultrasounds, obstetric ultrasound, and things around that area. My first work out of graduating from an ultrasound school happened to be in the space of IVF. And that's the reason why I'm in this space. And it's been almost 25 years. It's been a wonderful journey. I would have never asked for any other space to be in. This space of reproductive medicine is my life, basically. I enjoy doing every little bit that I do. And it's just always a pleasure to assist couples that are looking for the fruit of the womb or to complete their family for very valid reasons that they couldn't do it for themselves. It's actually very fulfilling. So that's a little bit about my background.
Yes. Thank you. Now, let me just mention this. Mrs. Adewusi is also the co-chair of the local organizing committee of the AFRH 2025 annual conference, which is taking place in Lagos in September this year. She's been very hardworking and working, almost unstoppable for AFRH. Now, to the topic of today, surrogacy. What is surrogacy for some of our audience that may need some little enlightenment?
All right. So surrogacy, like we all know, is a word that people just, throw around. But the reality is that surrogacy is a form of treatment in the space of assisted reproductive technology. And it's the art of having a healthy adult carry pregnancy on behalf of an intending parent that otherwise cannot do it by themselves. So what does that mean? That means that there are three people involved in this process. It's a third party treatment. A man and a woman are trying to have a baby, but the wife is unable to carry the pregnancy because she has some underlying health issues that will prevent her from successfully carrying this pregnancy to term. And then they engage another healthy female who has gone through successful pregnancy and childbirth in the past and who is able to carry or voluntarily, offer to carry this baby for this couple who are not able to do so. So the egg and the sperm is from the intending parent, and the surrogate is offering her womb to carry this embryo successfully to term for this patient. So that's what surrogacy means in a nutshell. There are two types of surrogacy. The one I just described is called gestational surrogacy, and there's another one that is called traditional surrogacy. Traditional surrogacy is the one that actually uses the egg of the surrogate that is, being engaged to carry this pregnancy, and the sperm of the husband, that is so. There are two ways it can be done. You can have this traditionally, have the husband meet with the surrogate, which we totally discourage, or you can inseminate the sperm of the man into the surrogate so that she can conceive almost naturally, but without intercourse. Okay. We also discourage this. Why? Because there's a lot of entanglement in that kind of arrangement. And we understand that some hospitals do practice this type of surrogacy, but in AFRH, we totally discourage it. It's not something we encourage. So our members of over 100 clinics are aware that what we specialize in doing is gestational surrogacy. So there is a distinct disconnection between the couple and the surrogate.
Now, where does this baby factory issue comes in?
Thank you very much. There's actually a bill out by one of our lawmakers on the surrogacy matter because he discovered, somewhere in his local community that there is a baby making factory, and I don't want to say he's mixing it up with surrogacy, but the truth of the matter is that this baby making factories, what they do is that they find some very young female and have them meet with some agile young men, get them pregnant, and once pregnancy is achieved, they deliver the baby and they take the baby from them and hand it over to the willing buyer, which is the patient. That's the baby making factory style. That's how they do it. So basically, it's something that now some of the baby making factory will tell you they're doing IVF. They would, so they have something called cryptic pregnancy where they tell the patient you're pregnant, start, take this medication, everything is fine, you're pregnant, but don't go anywhere to do tests, don't go anywhere to do ultrasound, but you're pregnant, sometimes when you lie to yourself over and over again, it becomes your truth. So even the patient knows that IVF cannot be done in 2 days, but they will do the IVF in 2 days and she will claim she's pregnant and she'll be going around as if she's pregnant. And then they'll tell her to come back at a certain time, maybe 7 months, 8 months, 9 months, it may even be 15 months before they find a baby for her. And they'll say, okay, it's time for you to have a baby. Come to our hospital or our clinic or whatever, they put together. And then the baby's here, go home, you have your baby. It's guaranteed. This baby making factory is guaranteed. And then they charge them so much money. And I don't want to believe that some of this patients or people that go to them do not know that that's what they're actually engaging in. I don't want to believe that because, it's just very obvious that they are a baby making factory. They would get young girls pregnant and hand over the baby to willing buyers.
This is very much discouraged in our society. And in fact, it's one of the things that is bringing disrepute into the fertility treatment space. But before we get deeper into the issue of controversies around surrogacy, what are the indications for surrogacy? You mentioned one.
Yes.
That the woman, for some reason, medically cannot carry the pregnancy herself. What are the other indications?
So the indications for surrogacy are enormous. It's a long list of it. So one that stands out very quickly is when you've had repeated failed IVF cycles. So a female showed up, you can't conceive by yourself, you sort out assisted reproductive technology, and you have 1 cycle failed, 2 cycle failed, 3, 4, 5, and there is no respite. The question is, do you keep going until you're finally successful, or you explore other treatment options? And usually when you have repeated failed cycles, the doctor will say, you might want to consider, especially when you're transferring very good embryos and it's not just happening, you will be eligible to use surrogacy as an option. That's number one. Number two, you may have an underlying medical condition like chronic high blood pressure that may just tip you over with pregnancy, or you may have, chronic heart disease that might tip you over. You may have lupus. I've had patients that showed up because they have lupus, and that one is like, it just cannot smell pregnancy. If you get pregnant, that's almost fatal. You may have congenital anomaly. Congenital means that you don't have, it's not due to any fault of yours. Even the medical condition is not due to any fault of yours, but that's the way you were born, and your anatomical makeup is not compatible with carrying pregnancy successfully to term. It may be as a result of previous surgery that went bad. I've had a 28-year-old show up. She doesn't have a womb. She only had her ovaries because she had fibroids. During fibroid surgery, her womb had to be removed to save her life. So if you are one of those, then definitely you're eligible to use a surrogate. And we do have some other instances where previous surgery has also created scarring in the lining of the womb. The lining of the womb is where the embryo actually implants and baby would grow and flourish. It's like a fertile ground or a non-fertile ground. So these are some of the indications for surrogacy. And I want to emphasize here and now that surrogacy is not open to anybody that says, I am too posh to push, or I don't want to lose my shape. That's the reason why I want to use surrogate. It's not for vain reasons. It's for serious medical reasons indicated.
Thank you so much, for going deep into the indications for surrogacy. Now, where do surrogates come from? How do we get surrogates?
That's a very good question because I get it all the time. I don't know if I mentioned that I run an agency that recruits surrogates, but I get this question from my patients all the time. Where do they come from? Do they fall from heaven? Or, you just have a bunch of them seated somewhere and ready to go through the process? And the answer is no, they don't fall from heaven. They're not readily available. These are healthy female that comes from different spheres. So it could be that a previous surrogate refers another person that may be interested in going through the process just like she did. It could be from subagents that are aware that something like this happens and they're interested in actually assisting and recruiting surrogates that may be interested in helping other patients. It could be online. It could be that, they call directly to indicate interest, and then they have to, of course, go through screening. So it's not everybody that indicates interest in being a surrogate that actually qualifies to be a surrogate, because there are so many screening processes that goes into it. So the fact that you've had a child before does not automatically qualifies you. The fact that you're a healthy female and you're making yourself available does not necessarily qualify you, because you have to go through some stringent screening, which includes health, medical, psychological, and emotional state.
Yes, thank you. Now, it's nice that you mentioned there are 3 sources that we can get the surrogates. One, from the intending parents themselves.
Yes, from intending parents. So usually intending parents will want to come with a family member or a sister or a friend of a friend. It's okay. It's okay. But we usually discourage that, because at the end of the day, you don't know what's going to happen 20, 25 years down the line. And then this family member will come back and say, after all, I was the one that carried this baby, so this baby belongs to me. I want this baby back. Well, baby would have become an adult at that time, but it is a fact. It's happened. It's happening. We know, we've seen examples of family members helping, and then something happens to the other person's child or children, and then they come back, to want to claim, the one that they've helped to carry the baby. So what we advise is, we are not discouraging you, but we're advising you against it, just in case. So you can make an educated decision about using a family member or a sister or a friend of a friend, that is really concerned about, your state, to want to help you. The best way in this our peculiar environment in Africa is to make sure that you go through the process without any attachment. Because if you have an attachment, they will come back for favors in the future.
Okay, so in a nutshell, we have anonymous surrogacy.
So basically, at this time in Nigeria, without any laws, without any legislations, we practice anonymous or semi-anonymous. So the closest you get to knowing your surrogate is to probably be in the same room, sighted your surrogate, know that she's fine, know that she's actually pregnant, and know that she's actually going through antenatal treatment, but you would not have a one-on-one interaction. She would not know your identity, and you will not know her identity, but you can actually sight her, within the clinic space. You can actually, see that, oh, she's fine, she's well taken care of, she looks healthy, and, she's doing well in pregnancy. But I've had some patients that says, I want to sit down with my surrogate and ask them questions and exchange, information with my surrogate. I don't discourage them, because that's what they want. And I would have given them a caveat that, hey, if this happens, please don't come back to me, but this is a possibility, and they're willing to take that chance.
And of course, the surrogates too also have to be consented.
Of course.
I mean, surrogate can decide, I'm sorry, I want to do this anonymous.
Most surrogates don't even want to, have any interactions, but some, they don't mind. Yeah.
Now, what are the qualifications? I mean, for a surrogate to be accepted, what are the criteria?
Okay.
That the surrogates must
So
meet?
the number one criteria, if someone calls me that they are interested in being a surrogate, is I would ask the age, because age is very important. For my agency, I try not to engage anybody less than 25 years old, for very good reasons. And the reason is because when they're younger, they're a little bit uncertain about what they want to do. They're not focused. They're sitting on the fence as to, I really want to do this for X, Y reason, but, I have other options, right? But when you're over 25, so I use surrogates between 25 and 35, and you have a child or children, you are very focused on exactly what you want and how you want to do it. Now, that may be a stereotype because we have some irresponsible 30-something-year-old surrogates, to be honest. But for the most part, you have their focus. They know what they want. They know why they're doing it. And they're very, very focused, and they're interested in the successful outcome because they have a goal. They have an end goal at the end, of what they want to do. And they've chosen to do it going through the surrogacy process. So that's the number one thing, the age. Number two is, of course, they have to have had a child or two. It's very important for a surrogate to have gone through pregnancy successfully and delivered without any complications. Number three, the surrogate has to be healthy. So the fact that you've had a baby before and you're within this age range that is acceptable does not mean you're particularly healthy. So they may show up with high blood pressure, or they may show up with, some other underlying health issues that precludes them from going through it. For example, hormonal profiles will be done. So if their thyroid function is not okay, or their prolactin level is not okay, then that's a problem. So, those are the things considered. And also, they would go through psychological evaluation. If you check all the other ones and you're psychologically unstable, nobody's going to engage you as a surrogate. Then they have to go through the legal counseling as well. The lawyers will sit down with you and go line by line to explain exactly what you're expected to do, what is expected of you, what is expected of the IP, what is expected of the agency. If it's not okay with you, then you don't have to go through with it. Okay, so you also, as a surrogate, you have to know that you have rights. You have the right to ask questions. You have the right to say, oh, why is this like this? How is this being done? So you're not a robot. You're not engaged to just sit down and be quiet. You are required to ask questions as you're going along. But these are the things that will be checked before you're actually engaged. And we actually need to know that this person is partly altruistic about it. Because the truth of the matter is that if you are not doing it to help, that's the number one reason you're doing it, to help. If you're not as committed as the intending parent and the agency that is engaging you, then there's no point. So you have to be in the process. We have a lot of surrogates, when they have a negative outcome, they cry like you would think there is their baby that did not implant. They would cry and cry and cry just because they are committed to the process and they want it to be successful, for various reasons. In fact, some get discouraged when they don't get pregnant the first time. They think, they've done something. And we try to tell them, it's not you. Sometimes it's other things that affect it. So they go through counseling every time, every step, so that they know exactly what the process is. Because it's so different because they themselves, they're asking questions. How is it possible that I can get pregnant without having intercourse? So all these things, you have to answer all these questions. You have to explain it to them. You have to break it down to them. You have to let them realize that once you start this process, you cannot do A, B, C, D, E. And it has to be acceptable to them.
It is pertinent that a surrogate must go through thorough counseling about what she wants to engage in. Pregnancy is not a walk in the park.
It's not.
There are some,
Risks.
risk to it. So surrogates are must be well counseled about what they want to go into. And the fact that at the end of the day, they volunteer to do this for an intending parent. And it must be highlighted that at the end of it, you will relinquish the baby.
Correct.
Yes.
Yeah.
Now, you mentioned something about altruism. Now, how do that factor in the Nigerian space?
So in the Nigerian space, my concept is that if you compare the Nigerian space with the Western space, because I'm not going to be specific whether it's the US or the UK or anywhere in the world, or Australia for that matter, you would realize that what we engage the surrogates to do in Nigeria is close to peanuts. And to be honest with you, if the underlying reason for the surrogate is not to help an intending parent, then what is it for? And the question is, we have the responsibility to make sure that these surrogates are comfortable when they're going through this process. We have to take care of them, whether you like it or not. I hate to talk about money exchanging hands, or maybe it's commercial, or maybe they're doing it because they're indigent, or they're doing it because they're impoverished. But the truth, Dr. Akinola, is that even a poor person, wretched person, have a choice or options to make money if that is what we're looking at. And surrogacy is not the only thing you can do that would give you big money. It's not. However, there is no amount of money that we can pay the surrogates that would compensate what they have given, as in themselves, to go through this process for for a total stranger for that matter. There's no amount of money. There's no price tag that you can put to it. Because at the end of the day, when they go through the process and they're successful and this intending parents carry their baby or their babies, they are eternally grateful to their surrogate, because that's a joy that knows no bounds. And how much can you put to that? What's the price tag? Is none.
So now, what are the responsibilities of the intending parents?
The responsibilities of the intending parent is to make sure that they engage the right hospital to do their treatment. In fact, that's the background of the responsibility. Do not go to any baby making factory to try to get a baby or buy a baby. Do not do that. The responsibility of an intending parent, after securing a good hospital, is to make sure that they have either the hospital engage a qualified agency that is going to do right by the surrogate, so that they can ensure that the surrogate is well catered for, well taken care of, as agreed. Okay? Because we do have some quote unquote clinic that does some funny stuff. It is the responsibility of the intending parents to make sure that they engage the right professionals for this process. It's a journey. It's a long one. It's not something you just go and buy in the market and exchange money and move on. This is a whole year process. So you have to be responsible as an intending parent. Do your research. Find out. Ask questions. Call multiple. See, in this space, there is nothing called competition. You have to do what sits well with your moral compass. And you have to make sure that the clinics you're engaging are also doing the right thing. And that's the reason why we encourage clinics that are really interested in doing the right thing, practicing the right thing in the space of ART, assisted reproductive technology, to register with AFRH so that they can see the self-regulating guidelines that we have put together for ourselves. There are no laws, we know, but we self-regulate ourselves. We teach ourselves, we empower ourselves to do the right thing by our patients at all times. So we have about 100 registered, over 100 registered AFRH clinics across Nigeria, and we're constantly educating ourselves, constantly guiding ourselves, and constantly ensuring that all our registered clinics are doing the right thing in this area.
Thank you. Now we have the surrogates, qualified by age. How do we clinically and medically investigate them to rule out any diseases present in them that will, endanger or put them at risk during pregnancy?
Thank you. So once we do the first stage of qualification, they're sent directly to the hospital so that the doctors can now do their own next level of screening. We call it vetting. Okay, so once the agency have identified a suitable surrogate, by the time they get into the hospital, all the baseline communicable diseases have been done. They've passed through the hormonal profile. Then the doctors will now do the physical test, and that's to make sure that they're healthy, the heart rhythm is okay, the womb is okay, and it's going to be able to accept very nice embryos. They themselves are balanced, they have very good hygiene, they're mentally stable, and they have they're also counseled, and it's almost like a double take from what the agencies have done. Okay, they said you're okay, but are you really okay? So they're going to go through another, it's almost like a duplicate but more intensive one when it comes to medical screening. So the doctors at that time will now say, okay, I want to go ahead with this surrogate, or no, I am not using the surrogate because in my opinion, she's not suitable. And if the doctor says that, there's nothing we can do about it because the doctors have the final say. Then the surrogate's out the door, we screen another surrogate and send to the hospital.
Yes. So in effect, medically, the surrogates must be medically fit.
Correct.
Before engaging in surrogacy at any clinic. We have to make sure as responsible professionals, they are not anemic, they don't have high blood pressure. And of course, as you said, the womb is suitable and can carry a normal pregnancy. And then there are some intending parents requesting to do psychological assessments, special psychological assessments of the surrogate, and then genetic screening of the surrogate. That, of course, is becoming one of the things that has been also generating controversy. How detailed can we do genetic screening of surrogacy? We'll come to that later on, because I know that not majority of the clinics in Nigeria are engaged in that. But that is something that is coming. And we too will be catching up to do it in Nigeria. Now, let's go to the controversies. One, you mentioned there are 100 clinics that are known to AFRH. There are unknown clinics. And of course, there are, probably more. There are, these baby factories. So those that are regulating themselves under AFRH are doing the correct thing. Those that are not under AFRH, that are out of our control, that even the baby factories, they are doing their own stuff. These are the people that we need, to find a way to bring them into focus, to follow what is done. How do you think we can, get to be doing this?
Dr. Akinola, that's a tough one because the truth of the matter is that The ones that we can identify that are doing the right thing, it's hard work to make sure that we continue to encourage them to do the right thing and to keep them in focus, to make sure that they're not deviating from our guidelines, right? And now you're talking about,
People outside.
people outside. I really don't know. The only thing I can tell the general public that are listening to this podcast today is that you have to be very careful. You have to be discerning. I know sometimes due to our desperation, we just settle for nonsense. Pardon my French, if you permit me to use that word, because at the end of the day, you might as well adopt, because adoption is another legal way of taking on another child that doesn't have your DNA at all, instead of going to these baby making factories. And these baby making factories are the one giving us bad names. They're the one giving us bad reps, because our patients out there, the general public that have no idea how this process happens, have bungled us professionals into the baby making factory people, or the people doing unscrupulous stuff. They claim to be clinics, but they really are a baby making factory. And some clinics, to be honest with you, that we know, they do IVF and they do all kinds of nonsense with it. All kinds of nonsense. How do you explain when someone tells you, oh, I'll use 2 surrogates, and then if they both get pregnant, we'll discontinue the medication for one and continue the other? Who gives you the right? How is that ethically right to, achieve conception and then terminate it because you don't want it? It is not right. There are no two ways about it. If you want to use one surrogate after the other, fine. But if you have engaged in using 2 surrogates, you better be ready to take all the babies that comes from those 2 surrogates, in my opinion.
Thank you so much. Now, it is all these unscrupulous habits about surrogacy and all the controversies it's generating that is now making it a topical issue in Nigeria. And this has splitted over into the National Assembly, where we have 2 bills.
2 separate bills, yes.
2 separate bills
on surrogacy.
On surrogacy. And these are made specifically for surrogacy. And we, AFRH, as the umbrella organization, that's have all the fertility professionals. What contributions are they making to these bills?
Thank you very much. AFRH is very much involved. When the Alawakala bill came out, we actually engaged him because him and his wife had gone through surrogacy with one of our registered clinics, and they had a successful outcome. And because they're so passionate about the process and they felt like they need to contribute to a legal and better way of going through the treatment as opposed to just going through it haphazardly. The clinic that they used did a fantastic job, got them the result. They're happy for it, but they're suspecting that some other charlatans out there may be pretending to do the good thing, but not doing the good thing. Okay, so there are some clinics that are pretending, oh, we're doing the right thing, but they're really not doing the right thing. So that's the perspective of Alawakala's bill. Okay, so let's make this legal. Let's have a framework. Let's make sure everybody follows this guideline. Let's make sure that nobody is exploited. Let's make sure that, they're vetted and controlled by certain government agencies. That's the perspective. The perspective of the other one, I think, is Mr. Uche Okonkwo, is that, there's some baby making factories And, we need to, and so we need to have, laws and guidelines. So, and it's quite distinct because the professionals are not baby making factories. So I think the law should actually go after the baby making factory and try to sweep them out, and that if there are laws, because the truth of the matter is that with the legislation coming in, AFRH is doing her best to make sure that we're part and parcel of the draft and the redraft and, the readings and all that, so that we can guide the lawmakers well to professionally execute this bill. The truth of the matter is that they have accepted to actually work with us, and we're working with them on this bill, and we're actively working with them. So it's a good step in the right direction. But they need to understand, the lawmakers need to understand that surrogacy cannot happen without assisted reproductive technology, which is ART. And ART itself needs to be regulated.
Yes. So, and that's led to the call by members of
AFRH that we need to legislate ART, and surrogacy would be a sub of ART.
Okay, so there will be a comprehensive bill
Correct.
About assisted reproductive technology techniques.
Yes, that's what we're pushing for.
Surrogacy,
like expand the scope. Don't just limit it to surrogacy.
The bill on surrogacy will be part of it.
Correct.
Oh, which is fantastic, which is very good. Now, before we go any further, I want to make it very clear that AFRH is not, or AFRH members and professionals are not baby making factory. And if you're out there listening to us, you want to engage in surrogacy, please follow the guidelines, follow the advice by Mrs. Adewusi, who is, fortunately, she's the chairman of the Fertility Support Group Association, that you should go to the right clinic. Don't, because of desperation, follow the wrong track and fall into the hands of unscrupulous people that will exploit you. And at the end of the day, can lead to a serious regret. Mm-hmm. Now, thank you so much. Lastly, what myths out there do you want to bust?
On surrogacy.
On surrogacy. Give us the myth about surrogacy that you feel, as the chairman of the association, wants people to realize that this is not true.
Okay, thank you very much. So one myth out there that readily comes to mind is that the baby being delivered by the surrogate actually has some DNA of the surrogate, because the surrogate is the one providing the water and the blood that is flowing in the baby. So because of that, some of her DNA must have been mixed with that baby as well. That's a myth. It's not true. We all know that the DNA of the baby actually belongs to that of the intending parents. And the intending parents at the end of the day will be the father and the mother of the child, even though, by Nigerian law, is the person that gives birth to the baby that is considered the mother. But of course, there is an arrangement, there's an agreement that is legal, that is binding on the surrogate, that, hey, this is what, when you have the baby, this baby belongs to the intending parent. You are just being gracious enough to carry this baby to help this couple. So once that understanding is established and baby is born, baby goes to the intending parent, and the surrogate is happy and appreciated for what she has done.
Now, lastly, we understand that some Nigerians abroad they do come home
A lot.
a lot to participate in surrogacy. Now, and some of them, at the end of the day, wants to take their babies back to their
Yes.
present abode, either US or Canada or Europe. So, what is the process? How does it
Thank you.
come together?
Yes, we do have a lot of patients that are in diaspora that comes home for this treatment, partly because or majorly because it's affordable in Nigeria as opposed to the Western world, which is fine because we have the technology here to be able to carry out this treatment successfully well. And because we've had several successful outcomes, a lot more people are coming. I mean, like I said, I think I've been back for almost 20 years in Nigeria now, and the rate at which our diaspora patients are coming in is alarming. It's just a lot. And they're coming because they've had a lot of successful stories. So when patients from diaspora are coming to Nigeria, please do your research a little bit. Depending on where you're coming from, just do your findings. Find out what the policies of surrogacy is in your resident abode. And of course, we know that in Nigeria, surrogacy is being practiced and it's legal. It's a legal form of treatment because IVF treatment in Nigeria is legal. It's considered an acceptable form of infertility treatment. So you can come and have your treatment done. But when you're going back, make sure that all the laws and guidelines for where you live is sorted and taken care of. So there's so many. I mean, the UK is probably the most cumbersome out of the lot, but I've done one in Ireland as well. It's not as bad because I know laws there, but you have to do so many documentations. They have to do certain things at the embassy. Canada does not like to, hear the word commercial in surrogacy. So you have to make sure that your documentation, the legal agreement, is amenable to where you live. So by the time you're going back, all your documentations are in order and it's properly worded. Let me use that word, properly worded. So you just want to do a little bit of assignment on that. In the US, it's quite simple. Most of the states now are okay with surrogacy. It's considered their right to be able to complete their family and procreate, and that's considered one treatment. And once you have all your documentations, your medical records, everything, you let the embassy know that you're expecting the birth of a child abroad. You schedule an interview, they take you in, they request for all the documentations, you submit it, everything's fine, they give you your document. The worst is they order a DNA. So basically, be truthful from the beginning and be truthful till the very end. Whatever you do, just, make sure you do your research, do your findings, especially for the place you live, where you intend to take this baby back to.
Yeah. Thank you, Mrs. Adewusi, for coming on today and enlightening us about surrogacy. Surrogacy is one aspect of the third-party reproduction.
Correct.
The other aspect is egg donation. Oocyte donation, that is human egg donation. And in due course, we'll bring another eminent personality to enlighten us about the process in Nigeria, you can go about it without any falling into the wrong hands, and how all the controversies against surrounding egg donation, we are going to bust it and make sure that people know where to go and they know what to do, and without, of course, running into problems. Thank you for coming.
Thank you for
you are well
having me.
appreciated. And we hope that any of our audience that have questions can channel it through Medicine Specialist Women's Hospital. We'll be happy to pass it on to Mrs. Adewusi for answer. Thank you. Please like, share, and follow us on all the social media that this podcast is being broadcasted. Thank you once again.
Thank you.
Bye for now.